My name is Kadra Abdul, and I'm your spokesperson for this public awareness campaign on chronic disease and Black health. It's brought to you by Taibu Community Health Center. Please join us on our discussion on diabetes and hypertension. We're going to be starting off the conversation with diabetes and hypertension. And so today we have our special guest. Thank you so much for joining us, Danielle Brown-Shreves. I've been practicing this the entire time. Thank you so much. You are a beautiful Black woman, but tell the audience that don't know you a little bit about yourself, your background, and how you got into this.
Absolutely. So I'm originally from Jamaica. I completed my medical school training there. I studied at the University of the West Indies. I moved to Canada and did my family medicine residency training at University of Ottawa, and have been practicing now for a little bit over a decade. Recently, I opened Restore Medical Clinics here in Ottawa.
Congratulations.
Thank you. Thank you.
That's amazing.
So it is a multidisciplinary clinic providing comprehensive, collaborative, compassionate care. It does have a mandate for vulnerable populations for which the ACB community is a large portion of the patients that we see here. So that's really my passion. I do have a master's in global health.
Wow.
And really love doing that work, solving health inequities. I do some academic work as well. I'm an assistant professor at Queen's University.
Wow, you're quite busy.
Yeah, I do have an adjunct professor standing at the University of Ottawa as well. So again, teaching medical students and residents.
Residents as well. Well, thank you so much, Dr. Shreves. As a Black East African Somali woman myself, it's always nice to see a woman of color, people that I feel like I can really connect with in the medical field as well. Today, trying to find a family doctor in Ontario, in Canada, I feel like is such a difficult task, and then especially finding a Black woman in the field as well. So I just want to say thank you so much for getting into this and being of service to us as well. So today I really want to get into the conversation about diabetes. You hear it all the time. You know, I'm not in the medical field, and so my first question is, I know that it's a chronic disease, but what is diabetes and what types of diabetes are there?
Sure. So you're right, it is a chronic disease. And basically it occurs when the pancreas either doesn't produce enough insulin,
right,
or the body can't effectively use the insulin that the pancreas is producing, right? So insulin is basically a hormone that helps to regulate blood glucose. Right? So imagine if the pancreas isn't able to produce sufficient insulin, or the body can't use the insulin, then you find that the glucose levels get very high. And that's you know, how diabetes occurs. And you know, there are several types. As you mentioned, the most common types are type 1. And in type 1, you'll find that that's where the body doesn't produce enough insulin, right? And there's also type 2, another common type, where that's where the body doesn't effectively use the insulin that it's producing. And then there's other types like gestational diabetes. Right? Where that one is detected, you know, first detected in pregnancy.
Right.
Yeah.
I've always heard about that usually when someone is pregnant.
Yes.
But even having this conversation with you, didn't know that there was more than 2. I've always heard just those 2 and then the pregnancy one, but it all is all combined in one umbrella field. That being said, what are some of the risk factors of developing diabetes?
Yeah, so the older you get, the more likely you are to have diabetes. So age is a risk. So 45 and older, you definitely tend to see it more common in that age group. A family history of diabetes will put one at risk, right? If someone has had a gestational diabetes, like if a woman had diabetes in pregnancy, they're also at a higher risk of developing diabetes in the future. Obesity is a risk as well. So the higher the weight, greater the incidence of diabetes in that group. There are certain ethnic groups as well that will have a higher rate of diabetes.
Okay.
And, the Black population is one of those groups that tends to have a higher prevalence. And that can be due to like a number of factors, right? Some of it's genetic, some of it relates to just how fat is distributed in Black people. Which can sometimes lead to more what we call insulin resistance or metabolic syndrome, and that increases the risk, right? The Black community also struggle with, other factors too, just even like lack of access to healthcare, socioeconomic factors that will also cause the rate to be higher in our community.
In our communities, yeah. Well, I've done my research. I have my piece of paper here, and I just want to share some facts. So the Ontario Ministry of Health stated that Black people are more likely to be diagnosed with diabetes 1.5 more times. And so that being said, how do you diagnose diabetes? Google's there for us, like I've said before. You can look at your Instagram and TikTok, but really, what are the main ways that you can diagnose diabetes?
Right. So, generally speaking, like some patients with diabetes can have certain symptoms, right? I should say that, people could go like years having their blood sugars high and not having symptoms, right? But for the most part, there could be symptoms like excessive thirst, frequent urination, fatigue, blurry vision. So there is a constellation of symptoms that you'll typically find when the blood glucose levels get very high. But in terms of like a clinical diagnosis, we rely on blood tests. Right? So, one of the blood tests that we can do is what we call like a fasting blood glucose, right? If that number is over 7, then that's one of the ways that we can diagnose it.
Right.
Another blood test that we can use is what we call a hemoglobin A1C, and that's just a 3-month average of the blood sugars, right? If that is over 6.5, that is also, again, suggestive of diabetes. And the last blood test that we can use is what we call a glucose tolerance test, right? Where, we'll challenge someone with some glucose, right? So they'll have a drink.
So I was just going to say, they actually drink it.
They actually drink.
Goodness. Is it? It's not delicious. I don't think it's.
Probably not. It's sugar. It's sugar. It's all sugar. And then 2 hours later, we'll check, right? And, depending on where those numbers are, then, we can diagnose diabetes through that means as well.
Let me ask you something. I remember at one point in my life, I was much, in terms of weight, I was much larger. And so I remember getting dark, almost like a shadow. Or I remember one of my aunts said to me, you didn't shower and you didn't clean the back of your neck with your rag. And I was like, well, I shower and I wash it all the time. And then I came to find out through my family doctor that it has something to do with my insulin level. Is that true? Can you really just touch on that? Like, are those myths?
Yeah, so, that was probably what we called acanthosis nigricans.
Okay.
And
sorry, repeat that again.
Acanthosis nigricans.
Got it.
Right?
Okay.
And you tend to see that, when the weight is more than it should be, right? And it does have a predisposition for diabetes, right? So your family doctor was correct.
Right. Yeah, it's like the earlier signs. That's what she told me.
It's one of those things that will like signal that you're higher risk for having diabetes.
Well, there you go, guys. You just learned something new. If you have those symptoms and you have those displays in your body, that it's not you showering extra or not changing your shampoo or your soap. Like, really talk to your medical professional.
Yeah.
And so thank you for that. My other question is, so can diabetes be treated? And if it can be treated, can it also be prevented? How can we prevent this?
Absolutely. So diabetes can be treated. In terms of, like treatment prevention, we always look at lifestyle changes, right? So active lifestyle, healthy diet. There's lots of evidence to suggest that the Mediterranean diet can help to prevent diabetes.
Really?
So eating lots of fruits, vegetables, grains, all that stuff. So
Okay.
really healthy diet and exercise can help. Even just weight loss, alone can like significantly lower your risk for diabetes. There are some persons who may require medications to manage diabetes, and that may be in the form of pills, or it could be injectables or insulin.
Right. If someone is diagnosed with diabetes, does it depend on the level of their diagnosis? Can they say, listen, before you put me on these pills, I really want to try a diet. I really want to try to change my lifestyle. Is there room for that?
Yeah, so it depends on where the levels are in the blood tests that I mentioned earlier. For everyone, irrespective of their blood sugar levels, we will suggest that healthy lifestyle, right? That active lifestyle. Everyone needs to do that.
Yeah.
For some people, that may be all they need, but not everyone. Some people will need medications in addition to doing all that stuff.
Okay. So there has to be a significant change in lifestyle either way.
Yep.
So for those that don't change the lifestyle, change their eating habits, change the fitness, what are some of the complications that they could potentially face?
Sure. So I should also say that, like most of what we're talking about now, we're probably focusing mostly on type 2 diabetes, right? Type 1, that one is a bit different. Most of the times that one is caused by genetic and environmental factors, right? So even if you do all the lifestyle changes, it may not prevent the diabetes, right?
Yeah.
Because the cells in the pancreas are not working as effectively, so the body isn't producing that insulin, right? So type 1 diabetics will still need to eat well and exercise, but that won't like reduce their risk.
Understood.
Right? Yeah.
Yeah.
Because they will need insulin.
Got it. So again, these myths that we have, you can be a completely fit individual, healthy lifestyle, eating well, and still have
Exactly. And most of the times you'll see that with type 1s, they are the patients who are thinner, right? So they can be slim, otherwise healthy, but, genetics, environmental factors interplay, and, their pancreas stops working effectively, right? So they will need insulin no matter what. Yeah.
Got it. Thank you so much for this. And for the individuals who are watching, where are some of the places that they can find support, their resources? What's out there for them?
Sure. So before I get into the resources, I'll touch a little bit on the complications.
Oh, of course, yes.
Right? Yeah. So if left untreated, there can be a lot of complications with diabetes. It can affect the blood vessels, it can affect small vessels, it can affect large vessels. So some of the small vessel complications that we can see is it can affect the eyes, right?
And in which way? Blurry vision?
So they can have blurry vision. We call it retinopathy, right? So the blood glucose levels get really high, and then it starts, affecting those small vessels in the eyes. It can cause problems with the kidneys as well. It can cause problems with the nerves. So, you'll find some diabetic patients, when the blood sugar levels are very high, they'll have what we call neuropathy. They'll get numbness, in their feet. And that is why it's so important for diabetics to always be checking their feet or having a foot exam, right? Diabetes can affect bigger vessels. So patients can, have a heart attack or stroke, right, with untreated diabetes.
Got it. So feet, eyes,
Kidneys.
Kidneys, okay, so they're all of the places. And so going back to support, the resources that are out there for people to really get this information for their loved ones and themselves.
Right. So I would say, family physicians can provide a lot of resources. Everyone who's diabetic, should be seeing their family physician regularly, right? So whether they, have a family physician or they're connected to a community health center, for example, like Taibu, there might be like a diabetes educator that can continue to provide, education. There are certain things that patients with living with diabetes should, have like consistently checked. Like, we want to make sure that blood work's been done like every 3 months to check some of those levels, like the hemoglobin A1C that I mentioned, right? If that number is less than 6.5, we know that, okay, the diabetes is well managed, right? So just recognizing the importance of having that follow-up is crucial. Having a foot exam at least once a year is going to be important, right? Checking the eyes once a year is really important, right? And then as part of the, the blood work, the family physician may want to like check the kidneys just to make sure there's no complications on that end as well. There are like, regional, provincial programs, diabetes focused clinics. Depending on, where patients are at, there may be like specific programs for patients living with type 1 diabetes, for patients with type 2 diabetes. So I think, just connecting to, a community health center or the family physician, I would say would be the first stop to start that support system, and then the family physician can refer as needed. There's some patients, if there are complications, we may want to refer them to whether it's an endocrinologist or a kidney specialist, for example, right?
Yeah, those resources are out there. So really staying on top of it, asking the right questions.
Exactly.
And connecting with your health professional that's out there for them as well. So thank you so much for this. This is definitely something that is affecting our African, Caribbean, Black community. And so thank you so much for having this conversation with us, Dr. Danielle Brown-Shreves. I absolutely love your name. Thank you so much for taking the time. And thank you, Taibu, for having this campaign of awareness for our people out there as well. So we'll be right back. My name is Kadra Abdul.
My name is Zainab Sheikh Tahir. I'm a mother of 5 children, and I have my ECE. I'm a registered ECE, and I also work with the Somali Center for Family Services. My mom is dealing with diabetes. I think type 1 or type 2, I'm not really sure which one it is. And it's very, very difficult because she doesn't talk about it. She doesn't tell us how she's feeling. All we see is her in a lot of pain. And at that time, we run around and we try to give her the medication. And as for the high blood pressure, I am dealing with it myself. Even though for me, I used to believe that the younger you are, you're immune to a lot of diseases. But what I find out is diseases, they don't have an age. They can come at any time, at any age. So by the time I find out, it was a bit too late. And it took the doctor, I think, close to 5 months for him to make me understand that I actually need medication for this. Otherwise, I would be killed by it. It's the biggest problem with men and female in the African society is because it's a stigma. So when you say you have a disease, people look at you differently, and people think that you're weak and you can't handle anything. So because it's a big stigma, people trying to keep their stuff to themselves, and they don't talk about it. And by the time they realize they have the disease, it's a bit too late. I hope that my community understand that we need to talk about this. It's not a stigma, and it's not that. We have to stop making it as a stigma, right? And we have to make it as it's normal. It's part of life. People get diseases, and people deal with it, and people come to work every day and they take their medication and they know how to handle their own diseases. So it's okay to talk about it. It's time for us to sit down together, talk about it, and find a solution for, if it's not for our sake, for our kids' sake, for our grandkids' sake. We have to be active. We have to talk to people, young people, older people, and we have to do workshops. We have to bring doctors, nurses, community leaders, and we just have to talk to people and explain to them it's okay to be sick. It's not, you're not gonna die from it. You have to maintain it and you have to be healthy. And you just have to do a little bit of adjustment and you can go on with your life and live a happy life. So many people have so many different diseases and you will never know.